commonly done. It is also true for anesthetists. Throughout the morning hours, they are anesthetists, but when it comes to evening, they have a small clinic, and they run that clinic as a general practice, a family practice, where they see a lot of family patients and they treat them. I'll give you a very hypothetical situation. This situation actually took place. There was a pathologist to whom a person came. HIV was to be studied. The HIV was positive. He reported it as HIV positive, and in the evening when the reports were available in his own clinic, he also counseled the patient saying that, see, now you are HIV positive, you've got to be careful. Once again, this particular pathologist also worked as a GP in the evening hours, as a general physician, family physician in the evening hours. The moment he was counseled, he realized how important it was, and therefore, next time, whenever he had sex with his wife, he started using condoms. See, a person who never liked condoms suddenly started using condoms. And he felt his wife was a moron. He felt that way. But wives are very intelligent, very intelligent. My husband, who never liked to use condoms, suddenly is using condoms. There must be something wrong. So what the wife did, she directly came and confronted the family physician in his clinic in the evening hours, and she asked him, what is wrong with my husband? Why is my husband doing this? Please tell me, you are hiding something from me. Now tell me, ladies and gentlemen, there are only two ways in which this particular problem can be solved. One problem is the family physician, who is also a pathologist, tells the wife, see, your husband is HIV positive. This is one way. And the second thing is, he says, well, you please bring your husband, let him sit in front of me, and if your husband permits, I will tell you whatever is the confidential information that I possess, which I have gathered in the course of my treatment for your husband. Amongst these two, which would be the right method is the question, whether the first method is right or the second method is right. Second method is right. Permission of the husband, I'll tell you whatever you want to know. Is that method right, or is the first method right? He directly tells her that, yes, your husband is HIV positive. What? Come on. Second method is wrong. The first method is right. Now, see, whenever there is a law laid down on a particular subject, it is always the courts that decide the law. Because medical law is not a statutory law. Medical law is a judge-made law. The judges lay down certain rules which become applicable to all of us. Now, what is the law with respect to HIV and the confidentiality that is involved with HIV is something that I'm going to tell you now. Now, see, this all is the fallout of a very important case law decided by the Supreme Court, and the name of this case law, for those who are interested, is Dr. Yeptomi versus the Apollo Hospital, Madras. Now, here what happened, I'll tell you, and how this particular law got settled is something very interesting. There was a young man by the name of Dr. Yeptomi. His friend was suffering from an aortic aneurysm, which had to be operated. So they went to Apollo Hospital, Madras, where blood was required, and Dr. Yeptomi donated blood. It was identified that Dr. Yeptomi was HIV positive. The moment it was identified, Yeptomi's blood was discarded. People gave blood. The surgery went off very well. They came back to Nagaland. That was the place where they were from. After some time, this Dr. Yeptomi got engaged to a very beautiful girl by the name of Miss Akali. And you know, small villages, small towns, and when a doctor gets engaged, it is, you're on the top of the world, everybody knows about it. And everybody came to know that Dr. Yeptomi got engaged. After the engagement, the would-be in-law started hearing something. And that something was, their would-be son-in-law is not of good, morals. And there was some HIV problems. So what they did was, they took the first available flight from Nagaland. They went to Madras, Apollo Hospital. They sat in front of the CEO, and they asked the CEO, this is my problem, please help us out. The CEO was large-hearted. He called for the files. And in the files, it was written that Dr. Yeptomi was HIV positive. The moment they came to know that HIV positive, Dr. Yeptomi was HIV positive, they came back to Nagaland, and the first thing that they did was, they broke the engagement. And when they broke the engagement, the whole town came to know that this Dr. Yeptomi was, Sarvaguna Sampanna, everything rolled into one. So the moment the whole town came to know about this, Dr. Yeptomi couldn't face anybody. So much so, that he had to leave the town. He went back to Madras, migrated to Madras, and from there, he filed a complaint in the National Commission. And his contention was very simple. He said that whatever transpires between a doctor and a patient is absolutely confidential, and the doctor has got no business to give away this information to anybody without the consent of the patient. And here what Apollo Hospital administration did was, they gave away this information regarding my HIV status to my would-be in-laws, as a result of which today the whole town has come to know that I am HIV positive. Now nobody is going to give me a daughter in marriage, and it is impossible for me to get married, so I want to be paid compensation. This was the issue. And he directly filed a complaint in the National Commission. In the National Commission, they said that, well, it is too complicated a matter for us to decide. We will not be able to decide it. You go to a regular civil court where evidence can be adduced. He further got annoyed and he filed a complaint in the Supreme Court. It was an appeal that he filed in the Supreme Court. And the Supreme Court came out with this particular decision, which practically changed the way we were looking at things. You know what the Supreme Court said? Supreme Court said that the decision taken by Apollo Hospital Madras was perfect. There's nothing wrong in it. It is exactly what we have been taught, opposite of what we have been taught. We have been taught all these years that whatever we come to know in the course of our treatment, we should never give it to anybody else, confide it with anybody else until we have an express direction from the patient. But the Supreme Court said exactly the opposite in this particular case. Whenever Supreme Court gives a particular decision, the Supreme Court will always give a reasoning for that decision. And that reasoning becomes very important. Here, what the Supreme Court said was, there are two rights involved in this particular case. On one side is Dr. Yeptomi's right to confidentiality. You know, whatever happens to him, it is confidential, and he has a right to confidentiality on one side. And on the other side, Miss Akali has a right to life. Miss Akali, if at all this particular wedding had been consummated, Miss Akali also would become HIV positive one fine morning, and then she would definitely have a premature death. So she also has a right to live a healthy life. And whenever these two rights clash, right to confidentiality, when it clashes with the right to life will always override all other rights. And that is why, if at all this particular information has been given, there is nothing wrong that Apollo Hospital has done. Apollo Hospital has done the most correct thing possible. Therefore, now, coming back to our problem, if at all you are a family physician, pathologist rolled into a family physician in the evening, and if at all the wife comes to you, and the wife says, tell me what my HIV status is, so will the family physician be justified in telling her, yes, your husband is HIV positive? Based on this particular case law, it is perfectly justified. In the year 2002, the Code of Medical Ethics changed. In the year 2002, the Code of Medical Ethics changed. And if you read the current medical ethics, Code of Medical Ethics, which is applicable even today, it very clearly states, if at all we possess certain confidential information, and we can identify a person at risk, and if at all we inform that person about the confidential information that we possess, we are doing nothing illegal, we are doing nothing unethical, and we are doing nothing immoral. That is why, in this particular case, if at all you've identified the wife to be at risk, and if the wife comes to you and asks you about the status of her husband, and if at all you tell her, you will be doing nothing wrong. The best thing to do as a pathologist, here the pathologist and the GP were rolled into one, but if at all you are an independent pathologist, and if at all a patient comes to you with a report, I feel it is always a very healthy practice to give such reports in a sealed envelope, and make it a point not to open your mouths and say that this report is to be given to your family physician or to given to your consultant, and your consultant will tell you whatever he has to tell you. Many a times I have found out that there is a private consultation that takes place, and some problems take place at that level, which makes settling things subsequently very difficult. So whenever such reports are present, such sensitive reports are present, put it in an envelope, seal it, and tell the patient to directly give it to his clinician, and let the clinician settle the issue directly with the patient. Now, another issue that comes up here in this particular case is the family physician in this case, the pathologist cum family physician in this case, duty bound to inform the wife? Are you understanding my question? See, there are two things. One is an act of commission, that I commit, something I do. And the second is an act of omission, something I omit to do. Act of omission is equally culpable. Act of commission, I have to pay compensation. And act of omission also, I have to pay compensation. It is equally culpable, it is equally actionable. In this particular case, HIV case, is there a bounden duty on the family physician or on the doctor or on the pathologist to inform the wife who is at risk, to inform her that yes, your husband is HIV positive and you are at risk, so take care. In other words, what I mean to say is, does the family physician go to the wife's house, go to the house, have a cup of tea, and tell the wife, do you know your husband is HIV positive? Is he bound to do it? Is there a duty cast upon? Sorry, I always keep it. Yeah, that's it. Sorry. Is he bound to do it? What is your question? What is the answer to this question? Come on. Identified. The wife is identified to be at risk. And if you don't inform her, she might get HIV positive. And you know. Is the family physician bound to do? Is there a duty cast upon him to inform the wife? Answer is no. No. Why? I'll tell you why. See, if you read the Yeptomi judgment, the Supreme Court in Yeptomi's case, Yeptomi judgment is silent on this particular issue. Yeptomi judgment does not say that whether the doctor is duty bound to inform. 2 minutes? You are extending it? Tell me when to stop, because otherwise it is never ending, these things. Huh? No, never mind. You shouldn't say that. I think it'll set everything will go haywire. See, is the family physician bound to inform the wife? The answer is no. And the reason is, if you read the Yeptomi judgment is silent on this issue. The Yeptomi judgment does not say whether the family physician or the doctor is duty bound to inform the person at risk. Why I say no is my particular evaluation after reading the judgment. I'll give you a very simple example. If at all there was a duty cast upon the doctor to inform the person at risk, then I think there is going to be absolute chaos. Why there is absolute chaos? I'll tell you. See, I'm an obstetrician. I practice in central Bombay, a big area. And I've been practicing for the past 40 years. I get all kinds of patients. Suppose there is a very beautiful commercial sex worker who comes to me, and I get her HIV done, and I find that she is HIV positive, and I know the half of central Bombay patronizes her. I know that. Now, if at all there is a bounden duty cast upon me to inform all those people who are at risk, then I have got to inform half of central Bombay that this particular patient is HIV positive, and you go to her at your own risk. In that case, I will have to put a small newspaper ad, a public notice, saying that this is what it is, and you are going to her at your own risk. Does the law expect me to do that? The answer is no. The law does not expect me to do that. And that is why I say, there is no bounden duty cast upon me by law to inform the person who is at risk. But, if at all there is a person who is at risk and who comes to me and asks me for this particular information, and if at all I were to give it, as per the decision of the Supreme Court, I can give it, and if at all I give it, I will be doing nothing illegal or unethical. This is how the law is settled in such cases. It is always decided by the courts what is correct, what is not correct, and that we are bound by. This is the second issue that I wanted to discuss today. Now the third issue that I want to discuss today, another very contagious issue. And this is whether a person who has CMLT, who is a CMLT or a DMLT, whether he can own laboratories, run laboratories, and sign reports all by himself without any assistance from a MD pathologist. This is the issue. And this issue is very much there in the courts. Today there is a stay on the issue. They cannot do it. The matter is seized with the High Court. But what is the technical point on this is something I want to tell you all, something very interesting. Now see, CMLT and DMLT is a recognized kind of a qualification. And when a person undergoes the particular course and passes that particular exam, he is able to work as a laboratory technician. As a laboratory technician, can he sign reports independently is the question. And I'm of the opinion that he cannot do it. As a laboratory technician, his job is just to assist the pathologist to do the laboratory work, and it is always under the instructions and the supervision of the pathologist that CMLT and DMLT people run laboratories. But today in Bombay, what has happened is there are plenty of CMLT, DMLT people who have got a better